McKesson and peerVue, intelligent workflow and communication in healthcare, and turning information into insight. In February of 2012, McKesson acquired peerVue as part of the McKesson Enterprise Medical Imaging portfolio. This extends McKesson's portfolio of enterprise imaging and information management systems with the highly flexible workflow capabilities of peerVue's QICS application. This allows McKesson to address site-specific needs in critical areas such as critical results management, peer review, emergency department communication, and more for multiple departments across the hospital. The integration of peerVue allows McKesson to be able to serve multi-site and multi-PACS workflow and communication solutions across the enterprise. And peerVue at its core always facilitates care coordination, which is essential to high-quality, safe, and efficient healthcare, resulting in more timely, efficient, and effective patient care. In a traditional radiology environment, many departments employ what we would refer to as a stopgap solution. These solutions tend to be manual or paper-driven tasks that typically occurs from the interpretation phase of the exam lifecycle. This would require the radiologist to interact with a very specific, boutique, specialized system for, say, critical results or peer review, which can result in complexity and cumbersomeness for the department, as well as a complex IT environment to support and manage. The other option for a stopgap solution tends to be a manual or paper-driven task that tends to be cumbersome for both the radiologist, the other clinicians on that patient's care team, and administratively when it comes to extrapolating reports. What peerVue does is takes a step back and looks at the exam lifecycle as the dictator of events, and understand that exceptional events occur as that exam navigates through the healthcare IT environment. From HIS to RIS to PACS to the dictation system and the billing system, this exam navigates through these environments, and events can occur at any time, such as duplicate incomplete order management, patient complication tracking, PQRS bonus reporting, critical results communication, ED discrepancy management, peer review, technologist QA, and billing and coding discrepancy management. The peerVue QICS product has the capability to be the glue that holds these systems together, and with its flexible ability to integrate with any PACS, PC, or workstation, has the capability to interact with users in their home environment, leading to minimal interrupted workflow. In addition, peerVue has the capability to extrapolate information across the healthcare enterprise, allowing for robust business intelligence reporting and workflow reporting, allowing organizations to have the business intelligence needed to give them the pulse of the department. Now, what makes up the peerVue solution? There are two elements. The first is a web-based panel. This panel can be launched from the Horizon desktop integration, or based on custom site business rules, has the capability to be automatically launched, prompting a user to engage its workflow. In this panel are custom attributes, agrees, disagrees, types of results, etc., fully customizable to meet the needs of the department. Also in this panel, peerVue has the capability to display any relevant HL7 DICOM data to make sure that this becomes a one-stop shop for the radiologist, such as physician contact information, patient location, reason for the examination, and more. All of the actions from the web-based panel typically take 3 clicks or less, and has PACS capability to launch peerVue with study context. The second piece of the peerVue environment is a web-based work list. Things get on work lists 2 separate ways. peerVue has the capability to query and assign to a work list, such as for peer review, technologist QA, and others, or every action in the system is going to populate an associated access-based work list for follow-up, such as if it's an ED discrepancy, it can go on an ED discrepancy follow-up work list. From these work lists, with one click, the user has the capability to drive directly to a study in PACS. From the work list, all the workflow takes place with 3 clicks or less. How it really works and where the magic occurs is on the back end peerVue's Qualitative Intelligence Rules Engine. This is where peerVue allows organizations to use HL7, DICOM, and peerVue submitted data to create custom if-then rule statements to drive their workflow. For example, a site can create rules such as if it's a critical result and it's an inpatient, maybe we page the ordering clinician. If it's a critical result and it's an outpatient, perhaps we send an email or an SMS text message. Additionally, not only do these rules initiate workflow, but they also give the capability to create escalation and reminders, ensuring that sites not only have the capability to kick off a workflow process, to make sure they have the appropriate escalations and reminders in place to hit site-defined turnaround time goals. In parallel, peerVue is compiling all of this data, time and date stamping it, providing patient demographic information, and other business metrics to provide robust reporting for audit trails, turnaround time reporting, review summaries, and more. And at the end of it all, customers have the capability to use this very simple three-piece concept, space panel, work list, and rules engine, and fine-tune it to meet specific workflow requirements, whether they're regulatory requirements such as critical results, quality requirements such as technologist QA, or other workflow challenges that the site may be facing today. They can use the peerVue platform to create robust workflow to solve those problems today and have the tools in place to solve the problems of the future.